The Roma people constitute a transitional ethnic community made up of various groups living mainly in Central and Southeastern Europe. UNICEF estimates that their population is around 12 to 15 million people. However, the exact number is unknown because many members of the Roma community have no national documentation and are hesitant to identify themselves due to stigmatization. Most of these tribes have originated from northern India, where they migrated westward around the 11th century during the Byzantine Empire. Now there are several groups of Roma, including the English Romani, Irish travelers, and Roma from Central and Eastern Europe. Some of these nomadic groups still exist today, but there are also semi-nomadic and settled groups, each of which can be characterized by communal solidarity, family bonds, cultural traditions, and language. The title Roma is frequently replaced with the offensive label of Gypsy, a title stemming from a legend that the early nomadic Roma people were on a penitent pilgrimage from Egypt because they had forsaken Christianity. The Roma community has endured oppression for centuries and continue to face discrimination today. When the Roma first began migrating into Eastern and Central Europe, they were welcomed under papal protection. Over time, however, they became subject to persecution, discrimination, and in some cases, slavery. In 18th century Austria-Hungary, many Roma children over the age of 5 were kidnapped and taken to non-Roma families to be raised. The 19th and 20th centuries followed with further persecution and mass genocide in Nazi camps, in which approximately 50% of the European Roma population was exterminated. The minority then faced segregation and an increase in racist attacks due to the fall of communism. The European Union has even recognized their important structural role in fighting discrimination against the Roma community, particularly in policy development, but health inequities between the Roma community and their non-Roma counterpart continue to burden the vulnerable population. Research has shown that the Roma of Central and Eastern Europe have a life expectancy that is up to 15 years lower than that of the non-Roma, and that they are more likely to recall having unmet health needs in the past 12 months. The severity of the health inequalities found in the Roma community have gained national attention in many of the nations of the European Union, as seen by the Parliament of the European Union statement in 2008 that noted extreme human rights abuses in the healthcare systems, including racial segregation in health facilities and coercive sterilization of Romani women. Geographical proximity to medical resources is not the main issue in the poor health outcomes of the Roma people. A study on 8,000 Roma and 4,000 non-Roma living in the same communities across 12 countries found that disparities in unmet healthcare needs remained present even after controlling for conventional measures of geographical access and health insurance. While improving funds and access to healthcare services for the Roma population is an important effort in societal inclusion of the minority, changes to the delivery system will be required to effectively mitigate the health disparities.